Hi, my name is Wasif. I'm the owner and pharmacist of Eye Care Pharmacy, and thank you for listening to the Eye Care podcast. If you like what you hear, please consider subscribing. We offer free delivery all throughout Edmonton. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition, either for yourself or for anyone else. If you do have any specific issues, it's always best to consult your own physician or your own pharmacist for any medical conditions that you may be having. If you do have any other questions about your health or about the podcast, you are always welcome to text me as well. You can text me at 780-705-8871, and I'll be sure to get back to you. Anyways, enjoy the podcast and thanks for dropping by. Take care and stay safe. Hi, I'm Wasif, and welcome to the Eye Care podcast. I have here with me Albert. Oh yeah, I pointed correctly there. Albert, who's a pharmacist and a friend, and then also Heather here, who's our special guest today. And so Heather is a registered nurse, and she's the founder of Advocann, which is a medical cannabis consulting company. That's right, Heather, right? I have that
Yeah.
correctly. Yeah, and then she's also the co-founder of Sandwich 911, which is an organization that helps connect seniors with and seniors and caregivers and loved ones with services to provide better care for seniors in need. Also, as well, she's a registered nurse with over 30 years experience. So thank you so much for joining us today, Heather. Really appreciate it.
Great to be here.
Yeah, and I also have my wife, Dodo, just off screen there. Say hello. Hi.
Hi, Dodo.
Hi.
Hey guys, how are you? I'm just off screen.
Good, you?
Yeah, usually,
Live.
usually we jump right into it, but I thought it'd be just kind of have a little fun icebreaker. I just wanted to kind of to get to know each other a little bit better. Just what is your favorite childhood cartoon or show when you were younger?
For me, probably the Munsters. I don't know if you remember it. I'm dating myself.
Yeah. What was I kind of remember it, but I remember the name, but I don't remember the show. Was it like similar like the Addams Family, sort of?
Yeah.
Yeah.
Okay. Yeah, I used to watch a lot of Addams Family back in the day.
Yeah.
Actually, have you guys seen WandaVision? They made a reference to the monsters just
Oh,
last
they
week.
did?
Oh,
Oh,
Yeah.
okay. No, yeah. I've been trying to get Dodo to watch it, but
Oh, you'd love it. It's all about sitcoms. Yeah.
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 For me, it probably had to be what comes to mind is like Gummy Bears. I don't know if this cartoon with these bears that would jump around and get into all sorts of shenanigans. Gummy Bears. Do you remember Gummy Bears, Albert?
Gummy bears. I don't remember gummy bears. I remember glowworms, though. Is that the same
yeah.
same vibe?
Yeah, a little bit different. I think Gummy Bears was only out for a season or two, so it was kind of short-lived. What about you, Albert?
Well, actually, every Saturday when I was a kid, there was always be like a stretch from like around 11 a.m. to 5 p.m., which is all straight cartoons. I don't think they do Saturday morning cartoons anymore, but
Yeah.
it started with like Teddy Ruxpin, then Inspector Gadget, and then Transformers and G.I. Joe. It was just non-stop fun, and that was just my childhood, just watching.
Oh yeah.
Looking forward to it every Saturday.
Saturday mornings were the best.
Saturday
It
morning.
was.
Yeah,
Good times.
The first thing that popped to my mind was Sailor Moon.
Sailor
But
Moon.
when I was living in Holland, when I was a kid, Saturday morning cartoons was like the thing. So you'd get up at like 7 a.m. and you'd watch it until about noon. So there was like X-Men and oh my God, there was X-Men.
X-Men.
Who was Aladdin? There was like the Disney shows. There was a He-Man, whatever.
He-Man.
He-Man, yeah.
It was like
He-Man.
it was epic. I loved it. And then we would like
He was wearing Uggs. Is that how you describe
yeah,
it?
he was wearing it.
Oh, yeah.
And so
He-Man was wearing Uggs?
yeah.
Well, I guess he has those boots. I
Yeah.
guess they were
Oh,
Uggs.
they're furry boots. That's true.
Yeah.
They looked like Uggs. And then the kids, and they were translated in Dutch. So all the kids would like go, like at noon, they would eat whatever. And then we would all go play for the rest of the day. And we would like all talk about what happened during all the cartoons. It was like the best thing
Yeah.
ever. I loved it.
So,
Life was good back then.
oh yeah.
It was
Not
good.
different now.
Pretty epic.
Yeah, so I wanted to get into kind of some of the myths in regards to medical cannabis today and just kind of pick on your expertise there. And like one of the first talking points was in regards to just like there's going to be a serious conversation, but was a reference to Harold and Kumar. So are you familiar at all with Harold and Kumar? Have you
Well,
watched the
I'm
movies?
more Cheech and Chong era.
Oh, okay, okay. Well, there's a scene in Harold and Kumar where Kumar gets into a hospital, and he he opens up these double doors, and the lights pouring in, and angelic music is playing, and he has found himself a stash of medical cannabis, and he is over the moon about what a good time he's about to have, but. Is he going to have a good time, Heather, or is he going to be pretty disappointed?
I think it depends on what kind of cannabis he found. If he found some of the stuff that I prescribe to seniors, he's not going to have that great of a time.
Yeah.
But yeah. So probably if it's high THC, he's going to have a great time.
Yeah. So what is the difference between, like, say, medical cannabis and what we would call like recreational?
Well, I think recreational now, you would say there's probably two stages. There's still kind of a black market cannabis that goes on, people that are growing it and selling it among friends. There's a lot of that still going on because it's relatively cheap. So that recreational type of cannabis usually has quite high THC, and it's grown to get you high for a lot of psychoactivity. And then the second level would be the cannabis we find in the dispensaries, like Fire and Flower or any of those Nova or any of those ones you see driving around. Those are all approved by the Canadian government. Everything they have in there is approved and checked over. So you can be assured there's no, like toxins, molds, things like that. And then, of course, there's medical grade cannabis, which is a step up again from that.
Okay. And then in regards to medical cannabis, do you, like, I know there's various different forms of it. One of the myths is you have to smoke medical cannabis in order to experience this benefits. So what would you say is kind of from my background, I was told that you should actually never smoke medical cannabis just because it has some of adverse effects, like it'd be similar to smoking. I don't know if there's as many carcinogens and as big of a risk, but I know that's kind of a gray area. But what are the forms that you usually like recommend for medical cannabis?
Well, I think young people, there's still a lot of people smoking, bongs, recreational. There's still bongs and joints being smoked and some vaping. But generally, people that are interested in medical cannabis are interested in it for their health, actually, not to get high. So they're looking for something that is nondescript so they can they're not going to smell it on their clothes. They don't have to smoke. And as healthcare professionals, we can't really promote smoking in any form. I certainly can't. So I think most of the cannabis that I would prescribe is usually oils because you can titrate them. And then they have capsules. So once you reach a good dose of an oil, then you can get capsules, like pills.
Yeah. And then you're earlier you're alluding to like how the recreational cannabis has a higher THC level, and so
Right.
THC is like the psychoactive component of medical cannabis. What is like the difference between THC levels between like medical cannabis and recreational cannabis in terms of like, I don't know if you'd describe it as percentage or.
Yeah, it is in a percentage. So THC that you would get at a dispensary for people interested in going out and getting high, like you would be going to the liquor store to buy a bottle of rum that's 40% alcohol. You can go to the dispensary and you can get 28% THC, which for most people would knock us on our butts. But I think that a lot of young people have a bit of a tolerance for it. People that are cannabis naive, on the other hand, like some of our patients that have never used any cannabis before, that would really be difficult for them. They'd use it once and they'd never go back. They would have panic attack probably.
Yeah. And then And then, so the other component of medical cannabis is CBD. So what are all the various things that CBD is like?
Good for?
Yeah.
Well, so the THC and CBD kind of go together. You actually need both of them to get a good effect for pain or anxiety or depression, or, you know, with MS and a lot of the neuromuscular diseases, you do need a little bit of THC. So what we're looking at is generally a 25-to-1 ratio. So I would be saying most seniors or most people that want to just start cannabis would be taking 25 milligrams of CBD, which is non-psychoactive. It will not make you high, but it's a good anti-inflammatory. And that little touch of THC, that 1 milligram of THC, really potentiates the CBD, a whole plant effect. So you need both, but in a small amount. The THC you won't get any hypo or psychoactivity at all if you have heavy dose of CBD with it.
Okay. And then Albert, in your practice, I know you work a little bit in a community, but do you have any patients have you had any medical cannabis questions at all?
Yeah, I think one of the more common things that I've been asked is, so we know that certain strains of marijuana can worsen anxiety, for example, even though it's a common misconception that we use marijuana to help decrease anxiety. So I guess the question I've been getting is, which ones are they to avoid? And I thought that was probably a more loaded question than I think. Heather, I don't know if you have any insight.
Yeah, so THC is a funny drug. Well, actually, cannabis is an interesting drug because in low doses, THC will temper anxiety and it will help with depression. Once you get at a higher dose, it does just the opposite. So it's a drug that you have to start. That's why they say start low, go slow. So you would start with the lowest THC possible with some CBD with it, and it works great for anxiety. But if you get too much THC, you can actually instigate anxiety and panic attacks.
Oh, and then if that's the case, then Heather, then what's the role of, say, terpenes? Because there's so many different compounds out there that, and all, I'm not sure if medical grade cannabis knows exactly the contents of each one of these ingredients, but let's say they were to smoke, for example, would it be very difficult for someone just to look at the strain and then tell them exactly how they're going to respond with respect to anxiety?
Yeah, well, generally, I think there's so many different terpenes. So linalool, there's lavender, there's pinene, there's actually a terpene wheel that I can get to you, and it kind of describes which terpene helps with which indication. Now, in saying that, the licensed producers are getting there with terpenes. They're pretty good, but like you say, I'm not sure exactly if their dosage is significant enough to help. So that's where all of this now they're making designer cannabis. That's what that's moving towards.
Okay.
Yeah, is using the terpenes and the CBD and the cannabidiol and all the different, there's like 400 different components in cannabis. So they're still learning what each and every one of them does.
Do you have a good resource for someone even like myself who's looked to as an information source? But I have some go-to reference sites, but I'm not even sure if those are evidence-based or if I should just redirect everyone to a cannabis specialist instead.
Yeah. Well, all of my research and everything I have is based on science, and the Canadian Consortium for the Investigation of Cannabinoids, and I can get that to you, is a really good resource because it's all medical. So, I mean, you're going to go on and find some of these leaf fly and some of these, and they're all pro cannabis. Cannabis is great. Yeah. I need research, and I'm sure you guys agree that's important. I like Tilray because I know the research scientist that does they've done more studies than anyone actually in Canada. And he's really good. He'll send me different information all the time, the latest studies, and the most interesting, things that are factual instead of all the fiction. There's a lot of fiction when it comes to cannabis.
A lot of fiction. Yeah.
Yeah.
Perfect.
So,
Yeah, I would love that.
Yeah.
So like when someone sees you for medical cannabis, what is the whole process? If you want to start from beginning to end, if you don't mind.
Okay, well, as a registered nurses cannot prescribe per se cannabis, and in Canada to have a cannabis prescription has to go through a physician. So they come to me for the research for whatever they're trying to treat. So I do have I wrote and I should have told Albert this at the beginning, but there's a course that you can take through Norquest College, Okanagan College, and another college down east. And I wrote that with a physician from the east, and it's Medical Cannabis for Healthcare Professionals. And it's a great course. Well, I've got all the information. So it's a great course for someone that really wants to learn about the medical part of it. So, and how that all works. So they see me and I teach them what is the best medication, what to stay away from. And then I will refer them to my physician, and the physician will, after I do the intake of, because some people, not everybody can use cannabis. They think they can, but they can't. And that prescription, the intake I send off, or the intake I send to the physician, and the physician will give them a prescription. He has to see them. He has to speak with them because he's actually writing a legal document for them. So I do the intake basically.
And then it gets passed on to the user, then the patient then chooses like a licensed producer, and you kind of help them walk through that process. Right.
So after the physician sends off the prescription to the Canadian government, everyone has to have a prescription. It's a legal document now. The licensed producer you can pick any licensed producer you want, and usually within about 72 hours, you'll have a license, and you can go to any producer. I usually say to patients to get the physician to send to Tilray, just because they're more medical. But there's some other great companies as well. I'm just used to working with them. And I don't get paid for saying that or working with them. I like their science. And then, I help them choose the best strain, because if they get the wrong thing, they can have adverse effects, and I help titrate.
And I should point out, just because some people might not know, what is the definition of a licensed producer?
So the licensed producers there's several in Canada, and they're approved by the Canadian government to provide medical grade cannabis. Now, there's a lot of places that aren't licensed producers that young people usually use, and you can go online and get a virtual visit and get cannabis. There's a lot of them in BC, but you're not getting cannabis from licensed producers. Licensed producers would be like Aurora, Tilray, Tweed, the big companies that have to be accountable for their products.
Okay. And then, you were talking about you also help with the process of titration, because just when a product is picked, that's kind of the first step for the patient in terms of, trying to figure out what the proper dose is for them, right?
Exactly. And one of the problems that happens when people go to the walk-in clinics is you can walk in and you see the doctor, and the doctor will write you a prescription, and you walk out of there with a prescription, and then you go home and order it. You don't quite know what to order. They give you some direction, but then when you leave, they say that you can call and you can get the help you need. But if it's on a weekend, or if it's after 6 o'clock, and the people that are teaching, I don't know the credibility of the people that are teaching you what to use in the walk-in clinics. So I'm just very leery to just let a patient go. I want to make sure that they don't get prescribed the wrong thing, because if they do, they can have some serious adverse effects. So I follow up all the way along. I've got seniors calling me on Sunday afternoon and asking me questions.
Yeah. And then I was also going to ask, let me, sorry, I forgot what I was going to ask.
That's okay.
Yeah. Do you have a question, Albert, or anything?
Actually, it sounds like you deal a lot with the senior population when you're initiating cannabis.
Right.
Any issues with like increased risk of falling, loss of alertness, like especially when you start to combine it with a, like an extensive regimen of other stuff? And any issues so far?
No, there are interactions that can happen because the cannabis is still that P54 or P450 enzyme that many of the medications are metabolized in the liver. So's cannabis, so's CBD. So yeah, we do have to watch. There are a couple of contraindications that have to be watched for. One of them is for PT-INR in people that are on anticoagulants. Which a lot of seniors are for atrial fib and whatnot. So it doesn't mean you can't use CBD. It just means that we have to watch their levels of bleeding times a little closer.
It increases bleeding times?
Yeah. It can. They can actually require less of their anticoagulants. So that's one of them. The other one. No, because my prescription is so low for THC that I never had a senior yet complain of dizziness or anything. No.
Gotcha. Okay.
Yeah.
I'm starting to see it.
And they love it.
Yeah, like during my care plans, like they'll happily bring it up because they're finding a lot of benefit with it. So it's we have to incorporate into our practice. There's no two ways about it now.
I wrote a letter in the journal probably a couple of years ago about using medical cannabis for seniors, and we have a lot of well-meaning kids, and they'll go to a dispensary and they'll get their mom and dad something to try, and that's where I see the problems, because generally they start them off with too high THC, and when they try it, if they try it once, they'll never try it again. It scares them off. And so that's why it's important to get the right medication for them, or the right cannabis for them.
Must be really interesting to see the changes in attitudes towards medical cannabis, especially considering you deal with a lot of the senior population.
Yeah, the next thing I'd like to see is doctors get on board with prescribing medical cannabis before opioids for chronic pain, because the research is so promising with CBD and getting people to reduce their use of opioids by pairing them together. And then there's actually a recipe for decreasing your opioids and using cannabis, and eventually trying to get off the opioids altogether. So that's
like when I was working with a physician maybe like 2 or 3 years ago in regards to chronic pain, they were saying that with cannabis, it can be opioid sparing, meaning that you don't need as many opioids while you're taking medical cannabis. So, but he was saying he was of the opinion that medical cannabis can never replace opioids. It can only be opioid sparing. But do you see in some cases where some patients are well controlled enough that they can get off the opioids potentially?
Absolutely. Yeah.
Okay,
for sure.
That's amazing considering, us being in an opioid crisis and that sort of thing.
We are. And about the best research is 60. There's about a 60 to, we've had as high as 74% reduction in opioid use in the first 6 months somebody's on medical cannabis. That's significant. If that was a pharmaceutical company, we'd be running this up and down the block, right? But
for sure.
Physicians have a hard time with cannabis because there's still a stigma, and physicians don't quite have their head wrapped around harm reduction. They don't want them to use opioids or cannabis. They don't want them to, they don't want them to use either. But we really have to think more along the line of harm reduction. And I think probably if you can use cannabis rather than methadone, or I'm not saying that's something to do today, but I think in the future, like Rob Tagaway in Calgary, he's doing a bunch of research on opioids, and he has written some papers on, and I can forward them to you, on getting patients off opioids by using cannabis.
Okay. And then
actually,
yeah, go ahead. Albert. Sorry.
Oh yeah, sorry, Heather. I was just gonna add a little bit to that. Like I actually see that a lot too. Like I see the pressures that our physicians in my clinic are facing with respect to decreasing opioid prescribing, but their only sort of course of action is just to wean people off, but not actually replacing anything. So for chronic pain, I mean, it's one thing to take them off an opioid, but if you're leaving them in pain, then that's not a good treatment outcome either. And so, yeah, maybe that's something that a lot of doctors can sort of learn a little bit more about, like with respect to cannabis prescribing. But I feel like the other issue is incorporating cannabis prescribing with just regular Schedule 1 prescribing, because I think like people having to go to 2 different places to get their medications already turns them off,
Right.
Yeah, so I'm not sure if there's any way in the future that would change.
Yeah, and I think that's something I'm hoping will be coming. But I think for physicians too, it's difficult for them because they can't prescribe a regular, like they can't prescribe a definite dose, and so it's so vague for them. I mean, they're used to saying 1 to 2 Tylenol, 3 Q4 to 6. You can't do that with cannabis because it's actually a self-regulated drug. So for some people, they might only use 1 gram a day and get great pain control with it, and other people have to use 3. So it depends on your own endocannabinoid system. So it's really difficult for a physician to hand out a prescription. It's a different feeling for them because they have to let go of a lot of control.
Especially with that whole titration that's needed.
Yeah.
As well. Yeah.
Can the pharmacist serve to follow up?
Yes, exactly. And I think that for you, what I see in the hospital working at the Royal Alex certainly is, yes, physicians all of a sudden have to be accountable for writing triplicates. So they just stop writing prescriptions for opioids. And we all know what happens to chronic pain patients. They go get it on the street, hence our opioid overdose problem, because they're getting, they have to get rid of the pain, and they're in desperation. They're getting recreational opioids that are killing them.
I wonder if this has anything to do with all the armed robberies recently to pharmacies. Like they just don't have access to it from their doctor anymore, so have no recourse but to steal it now.
Absolutely. Yeah. I have a niece that's a pharmacist, and she's been held up. My brother was held up.
Me too.
He's a pharmacist. Yeah.
He
had
Albert was held up like a couple of weeks ago, and
I got bear sprayed a couple times.
Oh yeah. No, my brother had a gun held to his head.
Oh my gosh.
Yeah. No, this addiction is serious, but why do we let it get this far? You just can't tell these people they have to go from 100 to 0. It's not going to work.
Mm-hmm.
And it's a vicious crime too, because I've seen so many people on the news. I was horrified when I found out that you were held up, Albert. I was just like, I can't believe this happened to you. And it makes me worried about Wasif and other people, too. So it's what the hell? This is crazy. Something needs to be done about this.
Hand over the keys to the narcotic cupboard and say, help yourself.
Yeah, that's
exactly. It's not worth it.
No.
It's not worth it.
I had a question regarding cannabis oil, and this is something that's been sort of on my mind lately. I had a horrible reaction to it when I was 19. It was 3 days before university. Is that okay if I share this?
Yeah.
Because I was so traumatized by it. So I was we were working at Sobeys. I don't know do you remember, Albert? Do you know that Sobeys in Riverbend? It used to be Sobeys.
Oh yeah.
Yeah, so I was looking around, and then I've never been the kind of person that even touched Advil. It's just not my thing. And so this was in 2004, and then I don't know, 3 days before university started, I tried I had a joint, I did, and I didn't have a like I was trying it for like I tried it 6 times in total with my cousin and kind of a few other friends. They're like, no big deal, whatever, right? Didn't think anything of it. I hated how I felt after that, but
Yeah.
I was young. And then yeah, it was 3 days and I tried it and I had, you know, I smoked a joint, I'm not gonna lie. I never told my mom about it. Had the worst reaction of my entire life. I thought I was gonna die. Because it was like this moment where my body was going from hot to cold, hot to cold.
Yeah. Yeah.
I still don't understand what that was. It was like a Zoom. That's what I felt like, a Zoom feeling.
Yeah.
And doctor told me it was a massive panic attack. It was actually pretty humiliating and demoralizing going to the doctor and saying, hey, I went through this. And everybody was making fun of me. They're like, oh, you greened out. I still don't know what that means. But ever since then, I've developed a high sensitivity to anything painkillers. Like I cannot handle Tylenol 3. I get really woozy. And so I'm just trying to figure out like what, like, because I know my cousin had the same type of, she smoked it too, and she didn't have any reaction to it. But granted though, she was doing marijuana for years before me. So I don't know till this day what I experienced. And so now I'm like afraid to touch any kind of medication. I refuse to even take the epidural when the time comes because I'm just not sure how I'm going to react to it.
Oh yeah, you will.
Everyone says
you'll take that risk. I'm telling you. No, I know exactly what happened. You were a cannabis naive, which yeah, you'd never tried it before. If you have any sort of underlying anxiety anywhere in your body and you use too much THC, which is what happened, you got too much, it'll throw you into the biggest panic attack you've ever had. And this is something is so uncomfortable because you can't, you know, if you're drinking alcohol and you have 2 glasses of wine and you start feeling, oh, I'm starting to feel a little, you know, a little drunk, you stop and then it goes away. But with cannabis, especially a high dose THC, you smoke it and you're stuck with it and it won't go away. It hangs around for 2 to 4 hours. Am I right?
Yeah, that's what it felt like. It felt like my body was like, okay, so
misery.
You know, of a Zoom feeling when your body's going from hot to cold,
yeah.
That's what happened. And so like everybody was trying to help me, but I mostly got laughs because you're just like getting, I mean, we were teenagers, we didn't know what we were doing, right? Like I don't think anybody did, but going to the doctor thereafter was pretty demoralizing because like, I think at the time no one really knew. They were like, oh, you're just a stupid teenager. But that whole experience kind of ruined my entire first year of university because it made me into a hypochondriac. Like I don't know, it just like destroyed it, and it really colored my experience with this whole cannabis thing.
Right.
To my next question. So now everybody's into it. Like I know somebody that I know personally, someone who had cancer and took CBD oil, and this is in Europe, and they said that it helped them through it. Yeah. So but people in my family are curious about CBD oil because of the gastro part of it. So in my family we have Crohn's and gastrointestinal. And what happens is if we eat certain foods, we get severe heart palpitations because of gas as well. Doctors say it's normal, but I'm wondering, does CBD oil help with stuff like that, with calming the stomach down? Is there any research about that? I'm really curious to know.
No, I actually have a patient on CBD oil for Crohn's. She's still using her biologics, not as often. She was using Remicade, you know, because she's got quite severe Crohn's, but it's totally kept it at bay. She did have to stop the CBD oil to go to Mexico because you can't fly with cannabis, of course. And so she was down in Mexico for a week and she had a total relapse with her Crohn's. So yeah, yes, in short, yes, CBD works well for any irritable bowel type of thing and Crohn's.
What does it do? Like if I'm
it's an anti-inflammatory. So it just really decreases the inflammation. And and you don't need, like, she uses, I think she's on a 25 to 1 too, actually. So she has 25 milligrams of CBD to 1 milligram of the THC. And yeah, she said she'd never be without it now.
That's such a good thing to know. Thank you.
Mm-hmm. Yeah.
Thanks for that.
So what are, like we kind of talked about chronic pain and then some of these gastro things. What are some of the other uses that a lot of your patients use the medical cannabis for?
Most patients are using medical cannabis for chronic pain, like arthritis is huge.
Yeah.
Osteoarthritis is a big one. Also, sleep problems. People with insomnia are using it. It helps them sleep, it helps them stay asleep. So a lot of women who are in menopause or perimenopause are asking for it to help sleep. And then stress and anxiety. It can really help with stress and anxiety. Have an anorexic on it who got off all other meds. And then, yeah, a lot of seniors as well.
It wouldn't help for like sleep apnea or anything like that. Does that
No, it just helps sleep. But, you know, it also can be used for MS, not so much for Parkinson's. I think it helps the anxiety with Parkinson's, but I don't think it works as well as it does for MS.
We had talked previously, and you said you had one of your patients who is a cancer patient using it. Was that more so for nausea, or is that pain relief, or both?
For nausea, I had a patient on. I forgot about that one, Wasif, because he's in remission. Yeah, he had nausea so bad that ondansetron wasn't working for him, and the cross couldn't seem to settle down his nausea. So his wife phoned me, and she was desperate. So yeah, I told her it was a higher THC, and she went and bought a vaporizer because he needed immediate release or relief, and it worked very effectively. He did have some psychoactivity though.
Oh, okay.
Yeah, which didn't bother him because he'd been on opioids, so it didn't bother him, and he ate, which was amazing.
Oh, that's awesome. That's so important, right?
Yeah.
Have like a condition like that. So with like you mentioned the vaporizer, so the vaporizer has immediate effect, but the drops and capsules, they work like 8 to 12 hours, I believe.
Right.
Okay.
So I mean, there's also a sublingual spray. There's a sublingual spray that's quite effective for people that have social anxiety, you know, just trouble, you know, maybe public speaking or going out shopping or whatever. It's got a little more, it's about a 5 to 20. So 5 milligrams of THC to 20 of CBD. The sublingual spray, of course, like other medications, works quite quickly. I have a couple of people using that have social anxiety. But aside from that, what else are...
How quickly does, like, say, a topical work? Like, I mean, not quickly, but how effective is it?
You know what? The topicals are getting a lot of attention right now. People are starting to kind of find interest in them. I haven't heard anything but anecdotal evidence that for some people it works great, and other people says it does nothing. I'm not sold on it yet, but I think they're doing more research on putting in more THC into the creams. There's some good creams out of BC, out of the coast, that aren't even from a licensed producer. I think somebody just makes them out there they're getting good results. People are getting good results.
Okay. Huh.
But I always am leery because who knows what's going in them, right? Like if it's not from a licensed producer, I just am not comfortable.
Yeah, that's kind of what I saw in regards to, just to kind of echo what you said, where like I've had patients who said anecdotally it's worked well for them, but when I kind of looked at the research, I didn't really find anything that says scientifically that, oh yeah, the topical is a good option. Yeah.
Like, are people still using topical cannabis for the same indications as like oil and like oral oils?
No, they're using it more like they would Voltaren. You know, Voltaren cream. Yeah, sort of on sore joints and muscles and joints and stuff. But no, the CBD that they would take, or the oil that they would take orally would be a different component altogether, or a different mixture altogether. Yeah.
Okay. And then if someone wanted a consultation with yourself, Heather, what's the best way for them to reach you?
Just email at support@advocann.ca and we can chat. So not everybody can use cannabis. There's a couple of things that bipolar, schizophrenia, anyone that has sort of addiction issues, addiction is always a problem because we don't know. Some people do find that high THC products, they become dependent on, not the kind of dependency that you would of cigarettes or opioids or anything like that, but it's more of a psychological dependency, I find.
I had a physician whose recommendation was that never to use like medical cannabis under anyone who's 25 years old. Is that
Agreed.
like is that a hard, or like, is that a rule that's pretty much in stone, or what's your approach to it?
I think it would depend on it always depends on the actual patient, because I mean, I had a patient that was for anorexia that was on Seroquel, it was on Prozac, it was on what else was she on? Oh my Lord, Lyrica. Like, they had her on so many different things for her to eat. And I actually found a psychiatrist that agreed that to try this cannabis, medical cannabis, and the patient got off everything.
Oh, wow.
Wow.
Everything, and was weight restored after 5 years of being in and out of the hospital. Now that is something.
Yeah.
So she was 23. So I think you have to look at each patient individually. Certainly under the age of 21, no. But the government in Alberta has said that people under the age of 18, over the age of 18 can use cannabis. So, I mean, technically they probably could use medical cannabis too.
Sorry, Dodo's just shaking her head.
No, it's just, I'm shaking my head because I'm like, where was this information 15, 16 years ago? It could have saved me so much
stress.
It's unbelievable. And this actually is what got me started, is in studying medical cannabis, because I just can't believe that you can change people's lives with it. And you can. I mean, it's true. It depends on the severity of your illness, but
and it's not recommended for younger people just because your brain is still developing. Is that correct?
Yeah, so we all have our own endocannabinoid system, and like everything else, when we're adults, it's fully developed, but it's still developing in kids, in young people. And also some of the diseases, the mental health issues that you see that come in young adulthood, like bipolar and schizophrenia, haven't been felt out yet in kids that are 16, 17, those young ages. So consequently, they will blame cannabis for causing schizophrenia, when in fact schizophrenia was probably lying quietly. It may have woken it up earlier than it would have had they not used cannabis. But usually that's kind of something that they're throwing around now. Probably doesn't cause schizophrenia, but it can bring it on earlier.
It's interesting because I have a friend who, like when he was younger, maybe 22, 23, he was smoking a lot of cannabis and he had a schizophrenic episode. So in that situation, the cannabis was blamed for the schizophrenic episode, but it may have been schizophrenia was just kind of underlying the whole time. And
it might not have reared its head until he was 26 or 28, but I mean, it can't, there's a lot of science that says you can't cause a disease with this. But I mean, I know that there's a lot of people can have paranoid breaks with high THC. A lot of people end up in emergency. I should mention with these edibles, they don't understand that edibles can take a couple of hours to start working. So they go, and all of a sudden they're so stoned out of their minds, they're freaking out, and they come into emergency, and they just have to flood them with IV fluids, and they have to wait it out.
Oh, I see.
It's a very uncomfortable feeling.
Yeah.
That is
Yeah.
so interesting because it just makes me look back on all these like experiences when we were teenagers and when we were in university, and I'm like just shocked at that. Like, and it's a good thing now. Like, I'm not going to look back, whatever the information. I'm happy that the information is there now. But my concern also is because of this information, because you know, cannabis and marijuana use is becoming more acceptable, and it's just a thing now. You know, kids and teenagers are looking to, you know, experiment even further, right? Because
Right.
everybody is doing that. One of the things that in the last few years that I've learned is that some of the students that I work with, they would go and they would, like, especially the Somali and, you know, the Arab, Middle Eastern Arabic,
Right.
smoke shisha, they would actually put the marijuana in the shisha, and they would have like
Yes. Yeah.
and teenagers are like upping the ante even more, not realizing, hey guys, like you have to be careful, because I've had a bad experience with it. I don't have an addictive personality, never had. I did have underlying anxiety, but thank God that's gone now. But had I known this information, I would have never touched it. Like I would have.
Yeah. No, it's a very uncomfortable feeling. Very uncomfortable feeling for sure. And it's hard. Usually people that have ever had that happen to them will never touch cannabis again. I mean, maybe CBD, like CBD, you would not get that same reaction with at all. But the kids, your kids that are using this, they're using recreational cannabis, probably not medical. So that's another thing you have to mention to your patients, Wasif, is that if you do get a prescription for medical cannabis, that it has to be locked up. If you, no different than opioids or any other, you know, Percocet or Tramadol or anything, it's got to be locked up because kids can get into it.
Oh yeah, no, that makes sense 100%. I never thought about it, but yeah, no, I would definitely have to mention that to them for sure. Did you have another question, Bonnie?
Oh no, I'm thinking more information, like, because again, you know, this knowledge I know are just through, you know, kids and talking rumors, and through the resource officers that, you know, when we had resource officers in the school that we work with, and just general information in the community that I work with. I want to be able to get more information out there about this, especially to teenagers that are now, you know, going through their experimental phase and doing all of that. And so that's what I want to get more access to, that, like information that's more catered to kids and teenagers, to be like, hey, like, this is the difference, this is what you can happen to, because I don't think there's an education out there about this. At least I haven't seen it. All it's like, don't do marijuana, it's illegal and stuff, but there is no, like, all they know is like, don't touch it, and of course they're going to do it, but why, right? There has to
They'll do it anyway. Yeah. No, I actually was at a conference, and they had they had some interesting research on brain development, and IQ actually can knock your IQ down a few points too if you use it before your brain's fully developed. So there is a lot of things that you would probably find interesting. I'll try and get them to us for you about kids using. They will use it though, and actually, in saying that, it's probably less harmful than alcohol. Well, it is less harmful than alcohol. It just is.
Yeah, because there are campaigns out there now saying, okay, like, you know, being high while driving. I've seen those around. More like a deterrent, and I understand that, because like, is that like the police, I think, put it out there, PSAs, where if you're driving while high, it's the same thing as being sleepy and you know, being under the influence of alcohol. Like, is that correct? Or because I've seen those.
Yes and no. So the cannabis, definitely, if you're feeling impaired, you're not supposed to drive for 8 hours. If you feel any psychoactivity, you're not supposed to drive for 8 hours after that. But for kids, I think probably they drive more cautiously on cannabis. They're still impaired, but from the research comparing drunk driving to high driving, drunk driving, they tend to be more reckless, drive fast, whereas when they're high, they drive slower and kind of a little more stoned. I don't know how to put it, but you know, they had kind of stupid accidents, right? But
they're basically going 20 kilometers an hour.
Yeah, exactly.
Being like super careful.
Like Cheech and Chong sitting in the car, and they haven't even gone anywhere yet, and they I always think of that when they talk about.
Like I
Driving.
get it, I was a teenager once, we all have, but I think it's really important to like just get the information out there, just so kids know, because like I understand, being a teenager, being young, and you're in college or university, it's like it's their time. Like, I mean, I'm sure Albert and all of us have stories of being stupid.
Oh yeah.
In the year, but I think
Well, I'm not talking about Albert because I don't know. For myself, I do.
Don't put the fingers at me, guys.
I worry more
I was
about.
thinking to dig at you, Albert.
Spotlight's on Heather right now.
I've known you, Albert, for 11 years. We've worked together, and we've grown together.
That's a different video, Doreen.
That's a different thing.
This can't be used as evidence.
No, I think I would worry more about kids using stuff that somebody grew, right, and sprayed it with a bunch of poison and toxins and mold, and smoking something that would damage them doubly. Like not the THC or feeling stoned, that will go away, but some of these things that they can be inhaling can do damage, can do long-term damage. So I mean, as far as I'm concerned, making it legal was probably a good thing for that reason. So at least people know what they're getting, but there's still a huge black market, and who knows what they're putting in that stuff.
True that. That's good to know and get information.
But you presented you gave us a lot of great information today, Heather. I really appreciate you coming on, and
nice to meet you.
Yeah. Thanks for lending your expertise to us. Really, really appreciate it.
Yeah, thank you so
Sure.
much.
Yeah, thanks, Heather.
Yeah, no problem. If you have questions, just email me at support@Advocann, ADVOCANN.com, and I'll chat.
Oh yeah, for sure. I'll include a link in our description too in regards to that. So yeah, thank you so much, and I really appreciate you taking the time to talk to us after a long day of work. So
Yeah, that's okay.
Nice
to meet you, Albert and Dodo.
Nice to meet you too, Heather.
Dodo, is that what what was your wife's name? Was it?
My name is Dodo, but my name is Darine.
She goes
I was going to say
Doreen, but we just call her Dodo.
Okay, I don't want to call her your pet name. I don't want to take that from you.
No.
Okay.
Can I call you Dodo?
Yeah, that's fine. I'll tell you guys the story after we stop recording.
Okay.
We have to find a pet name for Albert.
Yeah.
Yeah. All right. Thanks again, guys.
Have a great day. Bye. Thank you.
Bye.
Thanks again for listening to the Eye Care podcast. Again, my name is Wasa from Eye Care Pharmacy, where we provide free delivery all throughout Edmonton. If you have any questions about your health, the podcast, or our delivery service, you can text me at 780-705-8871. Take care, and thanks again for dropping by.